We had such a case in the first few days. She had polycystic ovary syndrome. Before seeking medical help, she had experienced 2 biochemical pregnancies. Normally, her menstruation was irregular, occurring every 3 to 4 months. With the diagnosis of polycystic ovary syndrome, she underwent ovarian wedge resection surgery. After the surgery, her menstrual cycle improved, and she became pregnant around the 5th month. However, she experienced another biochemical pregnancy. Upon examination, there were anti-embryo antibodies associated with immune miscarriages and an infantile uterus. These 2 diagnoses led to pregnancy loss after conception. Biochemical pregnancy is an indication of recurrent miscarriages, with immune factors being the predominant cause, followed by an infantile uterus and uterine septum. To achieve a cure, this patient needed a second surgery. A corrective surgery for the infantile uterus was performed, along with the use of a uterine shaping device. The aim was to transform the uterus into an inverted pear shape, with 80% on top and 20% below. Currently, her uterus is only 1/3 corpus and 2/3 cervix, combined with immune factors, leading to early pregnancy loss. Incomplete diagnosis leads to incomplete treatment. Fortunately, this time the diagnosis was comprehensive. 1. Recurrent early miscarriage. 2. Immune-type infantile uterus. 3. Polycystic ovary syndrome. 4. Secondary infertility after ovarian wedge resection. We treated these 4 diagnoses accordingly, necessitating a second surgery. Suppose she had undergone anti-embryo antibody testing before her first surgery. Considered a panoramic 4D ultrasound image confirming an infantile uterus before surgery. Preoperative immune therapy was administered. During the surgery, not only was the ovarian wedge resection completed but also uterine cavity shaping to correct the infantile uterus. With these interventions, she became pregnant after 5 months, confirming the incompleteness of diagnosis and treatment. Diagnosing infertility is extremely critical in clinical practice. Infertility is not an isolated ailment, it arises from over 150 clinical outcomes of various diseases. These outcomes are symptoms or clinical manifestations. If our diagnosis is unclear, treatment outcomes will surely be ineffective. Incomplete diagnosis necessitates multiple treatment attempts. In clinical practice, there is no one-size-fits-all cure for infertility. No single medication, technique, or surgery exists. Neither do the so-called infertility specialists or infertility clinics. Why? Because these 150-plus conditions are distributed across various specialties. Surgery, internal medicine, obstetrics and gynecology, urology, and even psychiatry. Incomplete diagnosis leads to incomplete treatment. Comprehensive diagnosis, however, leads to complete understanding. It requires both anatomical and functional assessments, even pathological examinations, to fully explain the clinical symptoms and signs she originally presented with.